Farmers and craftspeople in Amish communities have been mixing two pantry ingredients to treat cracked, rough, and inflamed hands for generations, and neither ingredient costs more than $1. Dermatologists charge for hand treatments that use the same two active mechanisms, just in more expensive packaging. Here is the original version. The two ingredients are castor oil and baking soda. And before getting into the mixture, it helps to understand what each one actually does to skin, because knowing the mechanism is what makes you confident enough to trust it. Castor oil is pressed from the seeds of the castor plant and has one of the highest concentrations of ricinoleic acid of any natural oil, typically around 90% of its total fatty acid content. Ricinoleic acid is a hydroxyl fatty acid, meaning it has a molecular structure that allows it to penetrate the outer layers of skin more deeply than most plant oils. Standard oils like coconut oil or olive oil sit primarily on the surface of the skin and form an occlusive barrier that reduces moisture loss. Castor oil does that too, but the ricinoleic acid also works into the deeper skin layers where it has documented anti-inflammatory properties. Research published in multiple biochemistry journals has confirmed ricinoleic acid reduces the production of prostaglandins, which are compounds involved in the inflammatory response that causes swelling, redness, and pain in cracked and damaged skin. This is why castor oil has been used for wound care and skin inflammation in traditional medicine across dozens of cultures for centuries, not as folklore, but as a functional treatment for something it is genuinely effective at. Baking soda in this combination does something completely different. The skin has a natural pH that sits slightly on the acidic side, around 4.5 to 5.5 for healthy skin. When hands are repeatedly exposed to soaps, cleaning products, soil, and mechanical work, this acidic barrier gets disrupted and the skin's ability to protect itself and retain moisture is reduced. Baking soda is alkaline, and in the small quantity used in this mixture, it does not overcorrect the skin's pH toward alkaline, which would cause its own problems. Instead, it acts as a mild exfoliant, gently loosening the dead skin cells on the surface that have dried, cracked, and hardened into calluses and rough patches. Once those surface layers are loosened and removed, the castor oil has better access to the living skin layers beneath where its anti-inflammatory and moisturizing effects are most useful. The exfoliation and the deep moisturizing work as a sequence, and that is why the combination consistently outperforms either ingredient used alone. The mixture for a single treatment is straightforward. Take a tablespoon of castor oil and add enough baking soda to form a thick paste, typically around a teaspoon to a teaspoon and a half depending on how thick you want the consistency. Stir them together until the baking soda is fully incorporated and the paste is uniform. The mixture will feel slightly gritty from the baking soda and slightly oily from the castor oil, which is exactly what it is supposed to feel like. Massage this paste into your hands, paying particular attention to the knuckles, the areas along the sides of the fingers, the fingertips, and the heels of the palm where skin tends to crack most severely from repeated use and drying. Work it into the skin for about 2 minutes rather than just spreading it on the surface. The rubbing motion is part of the exfoliation, so the massage step matters. Leave the mixture on your hands for 10 to 15 minutes, then rinse with warm water. Many people do this before bed and choose to apply a small additional amount of plain castor oil without the baking soda afterward, since the exfoliation step has already been done, and the oil alone absorbs overnight without needing to be washed off. Sleeping with a thin layer of castor oil on freshly exfoliated hands, with or without light cotton gloves to help it absorb rather than transfer to bedding, is one of the most consistently effective overnight hand treatments available and costs a few cents per application. For hands that are severely cracked, meaning skin that has split open and is tender or slightly bleeding at the deepest cracks, the baking soda exfoliation step should be skipped on those specific areas until the splits have closed. Open wounds should not be exfoliated since this can introduce irritation into already compromised skin. Apply plain castor oil only to open cracks and use the full paste mixture on the surrounding calloused and rough areas. Within 3 to 5 days of daily treatment, most shallow cracks close, and the full mixture can be used across the whole hand. The broader history of castor oil in American farmstead life is worth knowing because it gives context to why this particular combination exists. Castor oil was a standard item in farmhouse medicine cabinets throughout the 19th and early 20th centuries in the United States, used for everything from constipation relief to skin wound care to lubricating farm machinery. Amish communities maintain these practices more consistently than the broader American population because their way of life involves more sustained physical hand labor than most modern occupations, and their hands reflect it. The hands of someone who builds furniture, tends livestock, works a garden, and performs heavy domestic labor. Year-round, develop a specific kind of wear that factory-produced hand creams designed for office workers do not address particularly well, because they were not designed for that kind of damage. The castor oil and baking soda paste addresses that specific kind of wear directly because it was developed by and for people dealing with exactly that level of use. There is a secondary benefit to this treatment that most people notice after about a week of consistent use, and that is worth knowing about in advance, so it does not come as a surprise. The ricinoleic acid in castor oil has documented effects on the health of nails and cuticles, as well as the surrounding skin, because the oil absorbs into the nail bed area and the cuticle tissue, where it reduces inflammation and improves flexibility. Nails that have become brittle or are prone to splitting at the tips, which is a common complaint among people who work with their hands in water, soil, or cleaning products regularly, often show visible improvement in flexibility and reduced splitting after 2 to 3 weeks of the castor oil treatment, reaching the nail bed during application. This is not an advertised benefit on commercial hand creams, partly because it is a slower effect that is harder to demonstrate in advertising. But it is one that people who use this treatment consistently report noticing without looking for it. One thing worth knowing about sourcing castor oil specifically, since the quality matters more with this ingredient than with most. Food-grade castor oil and cold-pressed castor oil are both sold at most health food stores and online, and either works for this application. Castor oil sold as a laxative in pharmacies is also typically food-grade and works identically for skin use. The one version to avoid is industrial castor oil, which is sold for mechanical lubrication purposes and may contain additives not suitable for skin contact. Hexane-extracted castor oil, which is sometimes cheaper, also loses some of the ricinoleic acid potency during the extraction process. Cold-pressed castor oil, which typically costs around $8 to $12 for a bottle large enough to last several months of daily use, is the strongest version for this application. The title references what doctors never share, and it is worth being honest about what that means rather than letting it become misleading. Dermatologists are not hiding this treatment. Most dermatologists who specialize in occupational skin damage are aware that fatty acid-based oils with anti-inflammatory properties are effective for the kind of wear covered here. What they typically prescribe instead are formulated pharmaceutical creams, because those are within the scope of medical practice, can be documented and tracked, and are covered by insurance billing in a way that telling a patient to buy a bottle of castor oil is not. The gap is not suppression. It is the difference between what fits inside a clinical appointment and what a farming community figured out through generations of practical necessity. Both work. The pantry version costs a fraction of the amount. If you make this mixture tonight and use it before bed, check your hands in the morning before washing them. The combination of exfoliation and deep moisture absorption that happens overnight is usually noticeable within the first treatment rather than requiring days to see a result. The knuckle areas and fingertip cracks are typically the first to show a visible change in texture. For severely rough hands that have been this way for years, consistent daily use for 2 weeks produces results that most commercial hand treatments marketed at 10 to 20 times the cost do not match. The next video covers another old farmstead skin remedy using an ingredient from the pantry shelf that addresses a completely different skin problem, one that affects people far more in winter than in summer, but that the pantry treatment handles year-round. Stay subscribed for that one. Let me know in the comments whether your hands are rough from outdoor work, from frequent hand washing, or from something else entirely, because the specific cause changes which part of this treatment makes the biggest difference, and I will tailor future content to whichever situation most of you are dealing with.